On this episode, we are speaking with cardiologist Dr. Grace Chua, covering what everyone should know about heart health. Before we get started, tell me in the comments where we're watching from and let us know if it's your first time joining us. Dr. Chua, thank you so much for being here with us.
Oh, it's a pleasure to be here. Thank you.
So I'd like to start off by talking about the basics of heart health. What are the most common heart issues that people experience?
One of them is high blood pressure. One of them is stroke. One of them is a heart attack. Another one is heart failure. And lastly, arrhythmias, which are like irregular heart rhythms.
So I think we're all familiar with heart attacks and strokes. Tell us what heart failure is.
Heart failure is a broad term. It's just to describe that the heart is not efficient enough to push the blood forward to supply the rest of the body. So everything kind of backs up. And so when everything backs up, people can get short of breath, they get fatigue, they can't do as much, and then they get swelling, either the ankles or the rest of their body.
So how many people in North America are experiencing some sort of heart issue?
It's quite common, actually. I'll use Canadian figures. So in Canada, about 1 in 12 people get heart disease. So that equates to about 2.6 million Canadians have heart issues.
So why is heart health something we should be paying attention to?
Heart health is important because we want to stay as healthy as we can as we age, right? And then because it's so common, we need to prevent. So the basics of heart health is prevention. And we can do this throughout our life. I think the earlier the better, because heart disease is a chronic disease, a lot of it. And so we need to do everything we can to prevent heart disease.
So heart disease is the leading cause of death in Canada and North America, and yet I don't feel like we talk about it all that much, especially for women. What do you wish women knew about heart disease?
When we're looking at heart disease, we always focus on men because men get more blockages in the arteries and more heart attacks, which then present to hospital at an earlier age. And women get protected by estrogen, so we don't present with heart disease until menopause, so typically 10 to 15 years after menopause. So then we concentrate on what comes through in hospital, so men tend to receive more therapies, receive more diagnostic tests compared to women. So women don't like to present with their symptoms as early. We're kind of long suffering. We don't want to say we've got symptoms when we have them. And so when women do get heart disease or an acute event, they tend to do worse than men. So there are differences, and a lot of people say also we get more atypical symptoms than a man does.
So you said atypical symptoms. How does heart disease present in women versus men?
So in the typical symptom, for example, of a heart attack would be severe chest pressure. It's like an elephant sitting on top of your chest on the left side, but it can be anywhere in the chest. And then you get sweaty. Typically, people are clutching their chest, so that's a typical sign of a heart attack. So as an example, in a woman, may not necessarily be like that. It can be different types of chest pain. It could just be shortness of breath. It could be very tired or dizzy kind of thing. So I would say women present more with atypical symptoms than men.
So what does having a healthy heart mean?
A healthy heart means that you've done everything you can to prevent heart disease. And so there are a lot of risk factors for heart disease. And so, for example, blood pressure. You need to keep a good eye on your blood pressure, make sure it's normal. Secondly is sugar, blood glucose or sugar. Keep a close eye on that and prevent your sugars from going up. Third is smoking, so no smoking, because that more than doubles the risk of heart disease or heart attack. Then also keep a good weight, a good healthy weight. Also exercise. So sedentary lifestyle is associated with increased risk of heart disease, and as well as other things that cause heart disease like diabetes and high blood pressure, all that. If you're sedentary, all that gets worse. So there's a lot of things that we need to do, and part of it is also healthy eating. I didn't mention that. Healthy eating to make sure that we don't gain the weight and we don't get into the bad habits of eating that will cause heart disease and high cholesterol as well. So the key is to keep an eye on it and really know your health. Because a lot of times people just ignore their health, and that's when you don't feel any symptoms, right? And initially, because you just have risk factors. But when you start to have the symptoms, it may be too late, right? Too late to prevent. You already have it. So the key is to start early and prevent it.
We're going to pause here and do our trivia question. Folks, if you answer tonight's question, you'll get our guide to healthy treats with a few delicious recipes you can try at home. And you will get it for free if you answer our trivia question, which is, true or false, the average adult human body has over 200 bones. Is that true or false? Does the average adult human body have over 200 bones? Put your best guess in the comments and you will get that awesome guide delivered to your Facebook Messenger inbox. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. So how do we know if we're at risk for heart issues in the future?
Depends on your risk factors. So we talked about blood pressure. So the more risk factors you have, the higher your risk, right? So the way to prevent is to knock off those risk factors and make sure we don't have them. So if you have high blood pressure, control of them. Cholesterol, keep your cholesterol level as low as you can, because cholesterol causes those plaques to form in the arteries, and those cause heart attacks. And sugar, being a diabetic, so try and prevent diabetes, right, as much as you can. And then a healthy lifestyle, exercise, and keep a good weight.
When it comes to our risk of heart issues, what role does genetics play?
Genetics can play a role in heart disease, particularly with coronary disease or blockage of the arteries. And so in that case, high cholesterol is a big factor, and there are forms of premature heart disease related to cholesterol issues that are inherited. There's also other heart diseases related to heart failure and so forth that can also be inherited. So, and some arrhythmias or heart rhythm issues that can also be inherited. But on the whole, it's not a huge factor, but it's something to keep aware of depending on the issue that you have. And I think seeing your doctor and getting that diagnosis, and they will direct you as to whether to look for a genetic link or not.
So let's talk a little bit about the connection between obesity and heart health. What do we know about how these two conditions are linked?
They are absolutely linked. So there are the common forms of heart disease are related to weight. And so for prevention, we know that treating these forms of heart disease by weight loss also decreases the incidence and the prevalence of these conditions. So by the conditions, I mean coronary disease or blockages in the arteries that can cause heart attacks, heart failure, as well as atrial fibrillation. Atrial fibrillation is an irregular heart rhythm in the heart that can lead to strokes and heart failure as well.
So how do we know if our weight is impacting our heart?
I would answer that in two parts. So number one, if you are overweight without any symptoms, you should be concerned because you want to do the prevention. You want to prevent heart disease. But when you actually have symptoms such as chest pain, shortness of breath, dizziness, feeling faint or fainting, then you have to find out whether or not there is an issue with your heart that's causing it.
So we're going to talk a lot about prevention in this episode, but top line, what can we be doing to prevent future heart issues?
Keeping an eye and treating our risk factors will prevent heart issues. So watching your weight, losing weight, keeping that healthy weight. So when I say healthy weight as well, it's not just about weight and height or BMI. It's about the type of fat that you have, because we know some areas of fat are cause more heart disease than others because it causes inflammation. And when it causes inflammation, it can really damage certain parts of the heart.
So where are the places on our body where carrying fat is more harmful than not?
So what we call visceral adiposity, or fat that's around the waist, right? So abnormal fat, not only around the waist, but the fat that causes inflammation can also deposit in organs. So it can deposit in the liver. So if you have fat in the liver, that is a really inflammatory fat. Fat around the heart. So we have a lining around our heart, but if there is fat around the heart muscle and that lining, then it can cause heart disease.
So, did COVID change the way you and your colleagues thought about the connection between obesity and heart health?
Absolutely. So what COVID did was a couple of things. So number one, it really decreased people's ability to exercise. We were all kind of shuttered in. It also made us eat more, so we gained the weight. All right. So then the risk for heart disease goes up because of those two factors. Those are two factors that directly affect heart health. And so I'll give you an example. After everybody came back to see their doctors again, I found that my patients really, most of them have gone into heart failure because they've gained the weight, they've not exercised. They've also gotten a little older, which is also associated with increased heart disease. But then that was a big impact on it. So that was number one. Number two also is, does COVID directly impact the heart? Yes, because there's an increased incidence. Studies have shown an increased incidence in diabetes because COVID virus itself can attack the pancreas, and also an increase in heart disease because the virus itself can attack the heart or cause inflammation around the heart. So after a COVID infection, I would say the first month, and it can go almost up to 6 months, you're at higher risk for an event. And also one of those events is blood clots to the lungs. We saw that a lot in the hospital when it was acute phase of COVID. A lot of patients died of blood clots in their lungs.
So, you've spoken several times about how healthy eating and exercise are really important for good heart health and preventing heart issues. What eating patterns have been shown to promote heart health?
First of all, what we call a Mediterranean diet. So I'll give you examples, really a balanced diet. So when we look at the plate, we want half of it as fruits and vegetables, half of it as grains, whole grains. The higher the fiber content, the better, because it really slows down the absorption of sugars into your body. And then a quarter of it is protein. And by protein, I mean good, healthy protein. So we would choose more chicken and fish over red meat, because red meat has higher fat and cholesterol. Also tofu, nuts, seeds, all that. Watch your plate, really. The second thing is avoid sugars, right? Simple sugars. So when you're thinking of carbohydrates to eat, you don't want the white stuff. That really can make a spike in your sugar as you right after you eat it, right? So really watch that. I think one of the big things that has affected us in terms of increasing risk of diabetes and heart disease is that increase in sugar content that we have in our diet, right? So, and obesity as well, right? So a lot of the sugary drinks, don't drink your sugar. Don't drink your calories. Eat it as fruits and vegetables, but don't drink it. And you'd be surprised how much sugar is in what we drink.
In case you're just joining us, we're here with cardiologist Dr. Grace Chua, covering what everyone should know about the link between weight and heart health. And we're giving away a guide to healthy treats that will definitely satisfy your sweet tooth if you answer tonight's trivia question, which is, true or false, the average adult human body has over 200 bones. Is that true or false? Put your best guess in the comments and you will get that guide delivered to your Facebook Messenger inbox. And folks, you can take our new My Weight Action Plan questionnaire to receive personalized suggestions to help you reach your best weight, all for free. We'll put the link to that in the comments. Can you talk a little bit about why reaching a healthier weight can help prevent heart issues in the future?
Studies have shown weight loss is the key at preventing progression of the disease, sometimes even regressing the disease. So, for example, we can take some forms of heart disease, such as we know that the irregular heart rhythm or atrial fibrillation, if you lose 10% of your body weight if you're overweight or in the obesity range, that actually regresses the chance of you to have this heart rhythm issue. You can actually cure it, goes back, at least, and prevent progression as well. So we've seen that in studies. So one of the cornerstones of treatment is not only medication, but we advise weight loss, exercise, right? And so there's a direct link in a lot of the things that we see in heart disease. So coronary disease or heart attacks also, there is a link that if you lose weight, then there is prevention of heart attacks as well as heart failure.
So what I hear you saying, it's not just losing weight before we have a heart attack that can lower our risk of a heart attack, but even after we've had a heart attack, losing weight can prevent another heart attack.
Correct, absolutely. So there's that direct link, and so it's never too late, is what the message I want to tell people. Yes, if you're in the preventative phase, do it to prevent disease. But if you're already had an event, then more so you need to lose that weight to prevent the next event.
Is there anything that men in particular should know about heart health and weight?
For men, they don't pay attention to their weight as much, right? And so it creeps up on them. And I think in society, it's not as important for a man to kind of keep a trim figure. So it's kind of okay for them to gain the weight, and it's okay for them to gain that abdominal weight. And so I think be aware of the risk, because the risk is not only in women, it's also in men. So try to avoid that. And I think alcohol plays a part as well. I counsel my patients to cut down on their drinking or even not drink at all, because these days we know that any amount of alcohol may be not great for your health. In order to prevent weight gain, because alcohol can promote weight gain, and also that abdominal fat that is related to heart disease.
Is there anything that women in particular should know about heart disease?
So women, first of all, we like to look after others and not ourselves. So take good care of yourself. Because one of the things we didn't talk about as a risk factor is actually stress, right? So I see a lot of women in my practice. They've looked after everybody else, and they're so stressed in their life. And so take the time to look after yourself. That's number one. Number two is that there is a correlation between certain things that develop in pregnancy and your risk for heart disease. So I think I really want to tell people that. So if you've developed, say, high blood pressure during pregnancy or diabetes during pregnancy, and then it goes away, but you're still at risk. So if you've had that, you're a higher risk for developing heart disease. So we've now built into our guidelines to actually pay attention to women that have had these conditions during pregnancy, and to look out for heart issues as they age.
So when it comes to things like high blood pressure or diabetes, I think we all understand that it's important to be proactive and treat it early. Is obesity something similar? Is it something that we should be paying attention to before we start having issues?
100%. So more and more now, there is a link between, there is an increase in obesity in young people and also children, right? I think the latest numbers have shown like a fourfold increase over the last 10, 20 years. And so I want people to know that obesity is a chronic disease. Whenever we think about chronic disease, it's not only the extent, but it's the duration. The longer the duration, the higher the risk. You can't be just say, oh, I'm okay if I'm I'm still young. I can have be overweight, and I'll lose it later. But no, when you're overweight when you're young, you're also you're building your risk, because it's the exposure, right? That's there, and also the habits that you build when you're younger it's harder to break as you get older. Believe you me, as you get older, it's harder to lose the weight, right? So it is a lifelong thing that we all need to think about.
So if someone watching at home has recently been told about their risk for heart issues and their doctor told them just eat less and move more, lose some weight, and didn't really give them any guidance, what would you want them to know?
I think you need to get more information on the specifics. It's really hard when it's just, someone's telling you lose the weight and exercise and so forth. But get specifics. Like, for example, exercise. How much should I be exercising? What kind of exercises should I be doing? Like also 150 minutes a week, so be very specific, of moderate levels of cardiovascular exercise. So cardiovascular exercise being things that get your heart going. So good walk, brisk walk, treadmill, it's whatever you like to do, swimming, cycling. So stuff that gets your heart going and not stop and go, what I call window shopping exercise, but more sustained. So 20 minutes at a time, 20 to 30 minutes at a time of exercise. So get very specific with your doctor and ask them, how can I do this?
As a cardiologist, do you recommend that someone sees a physician who specializes in weight management if they're really struggling with their weight?
Yes, I do. Because as with any condition, and if you want to treat it, you want to go see somebody who specializes in it and can counsel you and give you effective therapies. And I think more so now than ever, we have so many effective therapies that deal with weight loss. And some of these therapies are not only for you to lose the weight, but they've shown now, for the first time, we're showing outcomes in terms of preventing heart attacks, preventing or improvement in heart failure with these therapies that we have.
Exciting times.
They are very exciting times and more to come.
So what's the number one thing you wish people knew about heart health?
I would say if people can see what heart disease causes in the end, if people can go into the hospital or even see somebody who's living with heart failure, being short of breath, poor energy, not able to do what they want to do, if they can see that, then they will pay attention to their heart and try and prevent the diseases by paying attention much earlier.
Such an inspiring answer. Thank you so much for joining us tonight. This has been a really informative conversation.
It's been my pleasure. Thank you.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, the average adult human body has over 200 bones? The answer is true. If you didn't get to answer the trivia question, but you'd still like those recipes, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.